Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I'm here today with one amazing co-host, namely Dr. Millicent Rovelo. How are you doing, Dr. Rovelo?
I'm doing amazing. Thank you.
And I upset her the other day.
The other day?
Every day. But the other day, I sent you a text because I wanted to mark an idea for the next podcast, which we're doing today, which is given to me by Caroline, my assistant.
You have to preface it to tell them what I was doing when you sent the text.
So she was in doing a facelift, which isn't the most brief procedure for Dr. Rovelo.
And I have never been known to be Speedy Gonzalez in any surgery. No. I am a snail who takes my time.
That's right. And I didn't send this with that in mind. I sent it to you because I wanted to mark the topic that we would address it. So I sent the question, how long does plastic surgery last?
So I come out of the OR and I'm checking my text and I see it from this guy. How long? And he knew I was operating because he was in the office. How long does plastic surgery last? I'm like, this effing guy. It lasts as long as it lasts. Jeez, get off my back.
I was like, no, that's a podcast topic. I wasn't ragging on you. She's like, okay, fine.
Fine.
But it's true.
The question is, in general, if you've had a plastic surgery, how many years do you get out of that?
How long does your plastic surgery last?
Not how long.
How long is this operation? So, Dr. Rovelo, how long does plastic surgery last? You know, it wasn't that. I wasn't trying to be a schnook. You know, I wasn't trying to be a, snide pain in your butt. But I thought it was a great topic, and
yes.
Caroline kind of, brought that to us because she was like, all right, well, so how long do these operations last? Because they, how long before you have to redo them?
This is an investment. People want to know, how many years am I going to get out of this individual surgery?
So, and the one that comes up where people think, well, how long does it last a lot is the facelift. I mean,
yes.
that is always a question. How long is my facelift going to last?
Right.
And depending on the technique, if you do a lunge, there is like a resurgence of the lifestyle lift, by the way.
Ugh.
Like in a big way.
Yeah.
In fact, when I was in, you saw Vladimir, he talked about it too, right?
Yes.
He even said I'm doing these little in-office kind of under local facelifts. Well, they don't last that long.
No, the lunchtime lift, you go in, not really at lunchtime, but you don't have to have general surgery for it, or general anesthesia.
Right, you can have just some local.
Some local lidocaine, like you're going to the dentist.
Have anesthesia.
And you lift the skin. You take a little bit out, you give a little tug, and you put it right back down. And you look better, you look refreshed. It's not dramatic, but if you have some extra skin, some loose skin, some hangy-downy skin, you look better.
Sure, it's quick,
better.
It's easy. It's not going to last long. People do ask me about, do you do this? And it turns out a lot of my friends in New York are doing that. They're doing these,
But they're not doing anything to the deeper structures of the face.
There are a couple little stitches, a couple little smash plication sutures.
Yeah. So all superficial, cutesy stuff that make you look better, but long term, it's not going to hold up because you're not doing the deep work of a facelift, addressing the SMAS, which is really the strength and structure layer of the skin.
Right.
And unless you're really manipulating that deeper structure, you're not going to have the long-lasting and more dramatic effects of a facelift. So yes, if you're doing that little mini lunchtime lift, then you can see your results last for a couple years.
2 years.
Yeah. And then you might have to go back and redo it or do something more invasive. But if you're talking about doing the full deep plane SMASectomy or SMAS flap facelift, your results are going to be significantly longer.
Yeah. I tell people you'll probably want to start thinking about refreshing it in 5 to 7 years, but by 10 years, you probably need to redo it.
You're probably going to need to redo it.
That's the truth.
And the redo is not necessarily going to be as intense and as involved as the first time around. The first time around, you really lay the foundation. You really redistribute the deeper structures of the face. So when you go back for a second or third or fourth facelift, it's usually a lot less invasive. You're just kind of re-elevating the skin, taking a little bit more, maybe pulling the SMAS a little bit, putting some sutures in it, but it's just a touch-up.
Yeah. And so 7 to 10 years is sort of the thinking.
Yeah.
Everybody
Because
ages
guess what?
differently.
You're still going to age. You know what?
Starts as soon as you get off the table.
We haven't figured out a solution to gravity. We haven't figured out how to keep the skin from aging. So yes, we can reset the clock. We can re-drape the facial structures, but we haven't figured out how to stop the aging process.
And it also depends on how well you take care of it as a patient. Do you go to the Medi-Spa? Do you do the lasers? And do you do things that is going to increase the longevity of your facelift?
Right. And also the quality of the skin that you come in with. So if you have a lot of sun damage and the skin is damaged at baseline, it's going to age a lot faster. Smokers are going to age a lot faster. Massive weight loss patients, their skin is not great quality. They're going to age super fast. So they may be in a little bit sooner than that 10 years, 5, 7 years.
I feel like I could do a meme based on the skin you came in with, but I'm not sure how that's going to roll out, but I'm going to work on that. Yeah. So that's the facelift. What about breast implants? That's another one that people feel is
big
time, there's a time factor. Like, how long are these breast implants going to last?
So, little history lesson for this one. Historically, the FDA said that implants should be swapped out every 10 years. And the reason for this was because implants at that time had a higher likelihood of rupture after 10 years. And we had the data to show that. Data was okay up till 10 years. After 10 years, the chances of the implants rupturing went up significantly. So the thought was that you have to go in every 10 years and get these implants replaced. And I have patients coming to my office still saying, well, it's been 10 years, I need to have these implants replaced. And if you had implants placed anywhere pre-2010-ish, 2005, that might be true. And we're talking about silicone implants here. Saline implants have an equal risk of rupture, but when a saline implant ruptures, it's not...
You know about it.
You know about it. Like it's ruptured water balloon and it's done. Here
Deflated
today,
breast.
gone tomorrow. And so the same data holds true for silicone versus saline. But right now we're talking about the silicone implants. I think any implant placed after 2010, 2012, their rates of rupture are significantly lower. And any implant placed after 2016, 17, most of these companies provide 20-year warranties against rupture.
20 years.
20 years. That's how long the implant companies believe they should last for before they are even concerned about them rupturing. They say, if your implant ruptures within 20 years of placement, we will give you money and replace it for free. They kind of put their money where their mouth is. So if you've had a recent implant within the last 10 years, that 10-year recommendation doesn't really apply to you. But if you're getting close to that 15 to 20-year mark, you might want to think about replacing them, only because if the implant ruptures, it is a bigger undertaking to replace it and to clean it out and do some capsule work. That being said, I find most patients end up swapping out their implants before 15, 20 years for cosmetic reasons. Time, age, gravity, changes in body. Maybe there's been some weight gain over the years, or maybe the implants they had when they were younger aren't the same look they want to have as they're older. So usually they end up being swapped out for aesthetic reasons.
Yep, and might need a mastopexy,
Might need a breast lift.
Yeah, so it can come up sooner. Especially the new Motiva implants have a very low rupture rate. Again, no financial
low.
interest.
Yeah.
But wish I did. Wish I did have a financial interest. Motiva, anyone? But the breasts are the breast implants and how the breast implant interacts with the breast tissue kind of determines whether that comes up as we need to do something about it.
Right. And implants are not designed to be lifelong devices. And I tell this to anyone that comes in for the first time for a breast implant procedure. Yes, you can take them out at any time, but the breasts will have changed significantly, and they may not go back to looking even as good as they do now. So it is a commitment, and you do, if you want to keep them, plan on having some maintenance and upkeep procedures. And the other thing is that the breast itself continues to age. So just because you have implants in doesn't mean that the breasts are going to stay high and perky forever. The implant might stay up nice and high, but your breast and the breast skin will kind of start to fall off of it over time. That's called a waterfall deformity. So you may need a lift, a little anti-aging, anti-gravity kind of surgery to get the skin and the breast back where it needs to be.
What about rhinoplasty? How long does your rhinoplasty last? Is it?
Well, that's a depends. Depends how it's done. Depends when it was done. Depends who did it. Because we've all seen rhinoplasties that do not age well.
Yes.
And
That's
then
for
we've
sure.
seen some that age really well. So I think that's a big depends in terms of how it was done initially.
Yeah, it depends whether it was a reductive removal rhinoplasty or whether it was some sort of removal and grafting procedure. So it depends. But
Yeah.
typically rhinoplasty should last.
It should. That's the idea.
It should.
Over time, the nose grows and the tip will start to droop. So theoretically, if you have a rhinoplasty that puts some strength and structure into the tip of the nose, you'll sort of have stopped that growing process and you'll have stopped the drooping process. Theoretically.
It should last. But
It
I have a
should.
whole revision practice
Yes.
of noses that did not last.
Right.
So I do find with, personally speaking with my noses, with the grafting that I do, they tend to last over time.
Right.
I for instance, I look at a nose I did in 2010 every single day, and, it was a revision that I did on my wife, and her nose is kind of hanging in there, you know?
Yeah,
So,
15 years later.
It looks good. Like,
Yeah.
I don't know. If you put the right grafts in, and now I'm even more aggressive about sort of holding the shape over time, so I think the noses can really last. But if they're old school reductive rhinoplasties,
Where a lot of structure was taken out, that's going to age.
I wonder what's going to happen with these preservation rhinoplasties, how they're going to age, because you're not doing a whole lot to the outside, right? Yeah, that's
Right.
the whole point. They should.
They should.
They should age well.
I mean, theoretically, they're being preserved, so they should.
right.
they should.
How will because the septal work in a preservation rhinoplasty is different. It's unique. And I don't know, over time, does that, will it change? I don't know. We'll see.
We'll see.
I'm brewing a paper about my revisions of preservation rhinoplasties now. I have about 33 patients, and they have some unique revision
Right. But that's not
issues.
an that's not
an aging issue,
Yeah.
but it's just about when it didn't turn out right. So for those of you wondering what a preservation rhinoplasty is, it's a technique where typically the bridge of the nose is preserved, and it's done through working on the septum and pushing the nose into the face to get rid of humps and things. You can read about it in the glossary of terms called Google. I don't do a whole lot of those. But what about your amazing tummy tucks?
Tummy tucks, yes. So I would say, blanket statement, tummy tucks age pretty well.
They do.
These are for patients that have extra skin, that their muscles, their rectus muscles have separated. So we've done the liposuction, we've removed the extra skin, we've put the muscles back together. And those patients, those tummy tucks age really well. I mean, we've all seen the women in their 70s that had a tummy tuck 30 years before, and their abdomen is still flat and tight, and they look great.
It works.
It works, except the massive weight loss patients. The skin. So in the mommy that's had some kids and has some separation of muscles and some extra skin, it works great. It lasts pretty much for the rest of their life. For the massive weight loss patients, even if I take out every extra inch of spare skin that they have, the skin that's left behind is not great quality, and it will relax and loosen again over time. Never, ever, ever, ever to the degree that they came in with. But to the point where it's 5-6 years have gone by, I can go back and take some more skin. They kind of need it to keep that tightening. Again, like we said with the faces, their skin's going to loosen and relax a lot sooner. So I tell them, if you want to maintain this tight, smooth result, high chance I'm going to have to come in. And again, nowhere near the big undertaking we did the first time. I'm probably going to have to redo your incision, pull the skin down a little more, trim a little more, because it's going to loosen up and relax over time.
Yeah, I think the tummy tucks do last really well.
They last really well.
They do. And, that it's a good operation, but it's a big operation.
It's a big one. But yeah, it does the job and it fixes the problem. And then sort of a corollary to that is liposuction. Just liposuction as a standalone procedure, or liposuction done in combination with a tummy tuck. Because we all get that question, right? Well, I heard that if you have liposuction, the fat just goes somewhere else. As if the fat picks up and takes its little suitcase and luggage and travels to your thighs. It doesn't actually move. It doesn't decamp and go somewhere else. But
Funny thought though.
right?
Hey, they did liposuction over here. We got to go. We're going to
Gotta go somewhere else.
We're going to go to the arms.
This place
we're
isn't
outta
so
here.
cool anymore.
This doesn't work for us anymore. No, it doesn't work.
It doesn't work like that. But that being said, say you have liposuction and maybe it was in an area that we call stubborn fat. So like if you exercise and eat well, but you still have these areas of fat deposits that never go away on the outer thighs or in your abdomen, that's called those are your stubborn fat areas. And we do liposuction on those areas. We're not removing every last fat cell. There is still fat remaining in those areas. And so if you are to gain weight, there is a chance that it could go back to those stubborn fat areas. But there's also a chance that you will now gain weight in areas that you might not have gained weight in before because there's just less fat in those previous areas of stubborn fat. So maybe if you used to gain weight in your tummy, you'll see a little bit more going on your thighs. But it's not that the fat cells have moved. You're just now seeing those areas get larger if you gain weight. That's the caveat. If you don't gain weight and you stay the same size on the scale, then it lasts indefinitely. It lasts forever.
Yeah. I mean, there's a finite number of fat cells in our body. When you take them out with liposuction, they're gone.
They're gone. But they can get bigger. You will not regrow new fat cells, but the ones that you have, you can make them a lot bigger.
Yeah, they can take on more lipid.
Yeah.
Yeah. The oil bubble in the fat cell
They can get real
be
big.
really big.
Yeah.
Yeah, I mean, that's the key. That's why when you do fat transfers, which is another thing, like how long does your fat transfer last? Well, initially it looks good, then it gets smaller, and then it comes back because the fat cells typically delipidate when you transfer them. They lose their lipid bubble just from like the shock of being transferred. So fat cells are really cool. It's a little teeny tiny nucleus and a big cell membrane with a big, bubble of oil in it. Mm-hmm. And when you move them, it just goes down to a little tiny cell. The first thing the fat cell does for survival is give up its oil bubble. And so when that happens, then the fat cell, gets comfortable, then it moves in, then it's like, all right, I'll take on some oil now. And then it starts to make it becomes a fat cell in the traditional sense of the word. So do fat cells go away when you transfer them? I say no. I say they transfer, they hang there, and then they either scar in and they don't really become fatty-looking fat cells, or they do, and then they can last really a long time. And in fact, if you gain weight, those fat transfers can actually get bigger with time because you've got an extra number of fat cells in an area you didn't have them before.
Yeah, and usually the trajectory for fat transfer, and this is fat transfer to the butt, to the breast, to the face, wherever you put it. Initially, everyone loves it because they're swollen. Right. They're like, oh my gosh, I look amazing. And I'm like, hold the phone. Don't get too excited.
That's right.
Let's give this 6 weeks to 3 months because what you're seeing right now, a lot of it is swelling. And then as the swelling goes away over a few weeks, they're like, oh, I see. And then what happens even after the swelling goes down is a portion of those fat cells are just going to die and get flushed out in your lymphatic system. I tell patients you lose probably 30% of the fat we put in because just not all of it's going to survive. And so then you have that 70% remaining. And like you said, they will sort of decrease in size. And then hopefully once they've attached and grafted and survived, they start to function like fat cells and take on a little bit more fat. But once they've survived and they're attached in that new home, they're there forever. And they will respond just like fat anywhere in your body. And if you have taken the fat from one of those stubborn areas that you tend to hold weight onto, the fat where you put it is going to behave like where it came from. And that's why we like to use those stubborn fat areas because they will hold on to the fat. So yeah, if you gain weight, you can gain it there. If you lose weight, you can lose it there as well. But it really just becomes a part of you.
So those they last variably. It's sort of the fat transfer kind of deal. What other operations should we kind of go through with this? I mean, blepharoplasty is sort of up there with with facelift. I mean, they typically your eyelid lift surgeries typically last. They don't even when you're redoing the facelift, the amount that needs to be redone on lids is pretty minimal. Lip lifts are the same way. Once you do a lip lift, I think that's over. That's done. You won't really have to lift the lip again. Yeah, it just isn't.
Right.
It's not an area that keeps kind of getting worse and worse.
I think it kind of like scars in.
Yeah, and that's stuck.
And then it just sort of stuck there. But yeah, so that's most of the face. The breast we talked about. Breast reductions.
Now, here's the trick, is they can regrow.
They can regrow. So especially if you had a breast reduction done when you were younger, which I do advocate for, because if you need a breast reduction, you need it, and no sense in keeping yourself miserable all through your 20s, waiting to have those kids. But if you have it when you're younger and you do go through hormone changes, whether it's pregnancy, breastfeeding, menopause, weight gain, weight loss, all of those things will change the size of the breast and the consistency of the breast. So you may be looking at breasts that grow larger or breasts that start to hang or sag more, and you may be looking at a revision. So that is not uncommon.
So we had a patient, I was at the University of Pittsburgh for my residency for 7 years, and we reduced the breasts of this one patient 3 times in the time I was there.
Oh, geez. That's unusual.
And she had full workups. She had full, like, hormonal this, that, and the other thing. It was very unusual, but, like, they just kept growing back.
You know, if you're genetically provided with large breasts, sometimes they just like to stay large.
Too much of a good thing.
Yeah.
But, you know, we reduced them, and they were uneventful reductions. Yeah. You worry about the blood supply to the nipple in a re-reduction. But, you know, it was all done by the same surgeon, so he knew what he did before. And so.
Yeah, in general, most of the time you don't know what the surgeon before you did when you're doing a revision breast reduction. Right. So you kind of have to just wing it. I do what I do in every other breast reduction, and for the most part, they do okay from a blood supply to the nipple standpoint. I really don't have any issues in the revisions any more than I do in the primary. So you can reduce it, and you can reduce it safely.
Here's another operation that people do wonder about is how long does your labiaplasty last? And
I would say forever, with the caveat that, again, hormonal changes, pregnancy, childbirth, all of those things can elongate the labia minora. So they do respond to hormones. And after pregnancy and childbirth, the labia sometimes are longer or larger. So theoretically, it should sort of be a permanent thing. But if you have any of those events after labiaplasty, you may see some elongation. But usually never back to how they were to start.
I've never seen I've never had a patient come back and say, hey, you know, we got to redo this.
Because even those things, the pregnancy and the childbirth and the menopause or hormone changes, it's a small change.
Yeah, I've never had to redo them, and I haven't heard of anybody having a re-operation on a labiaplasty.
Yeah, for growth reasons.
Yeah, exactly.
Yeah.
I've had some revision labiaplasties, which are difficult.
It's challenging.
That came from elsewhere. Yeah. They're not easy. What other ops then? What else is there that we would have to wonder about?
BBLs.
Do more BBLs.
Just do more BBLs, Dr. J.
That is the quote from my daughter. Don't worry about it. Just do more BBLs and you'll be fine, Dr. J. I think BBLs last.
Brazilian butt lifts, otherwise known as gluteal fat transfer.
They last.
These are patients that usually get, depending on how much fat they have to give, small volume or high volume liposuction that then gets injected into the butt.
Yeah.
And you got to know what you're asking for, because these don't go anywhere.
They don't.
Once it's in the butt, it's kind of there. It'll go through its phasing of swelling and losing some of those fat cells. But then once whatever you have takes, that's what you got.
You own it.
You own it.
That junk in the trunk is not going anywhere.
It is not going anywhere. And if you gain weight, chances are it's going right there, because you probably put most of your fat into your butt. So it can. You gotta like that
look. Mm-hmm. That is a look.
It is a look, and unless you aggressively revise it, do liposuction of it, it's not going anywhere.
That is so true.
Yeah.
And we've seen it. We've had to do some BBL reductions. You're going to go suck out the fat,
Yeah. And
just too big.
And the problem is, so the problem with the BBLs, and we could do a whole podcast on this, is that it's like anything. If you have large breasts, over time, they're going to sag more than small breasts. And so if you have a large booty, over time, it's going to sag and fall more than a small booty. So now you're looking at revising, doing a butt lift, a surgical excision of skin. There is going to be some maintenance to it. That it can be a little bit more than you asked for, maybe initially.
Nothing like a good BBL, though. Some people really need it, and it's great. And some people just go for, I'm just not sure what they're thinking.
They like it. It's a look.
Whatever. It's a look.
Yeah. To each their own.
We don't judge. We just try to help people
Understand.
realize their aesthetic visions.
Yes.
Yeah, I think that's it. I think those are the main operations and how long they
that's it.
last. And I think that's a good guide for people to start with. And then obviously you can dive a lot deeper and always ask your surgeon what they think because their techniques may be different. They may do something that's, really short-lived or really long-lasting and something cool that we don't even know about. So,
Totally.
excellent. Well, then this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.